this lesson, we will review how to use the symptom-guided management and specialty referral guidance tables. By the end of this video, you will be able to apply primary care management strategies to service members who are not progressing as expected in the PRA, and recognize indications for specialty referral. The symptom-guided management table provides evaluation and primary care management strategies for the most common symptoms associated with concussion. The specialty referral guidance table provides recommendations for referral if a service member has symptoms that persist longer than 15 days or potentially sooner based on clinical judgment. Both tables group the most common post-concussion symptoms into 7 symptom clusters, which include anxiety, mood, cervical, cognitive, headache, oculomotor, sleep, and vestibular symptoms. The symptom-guided management and specialty referral guidance tables provide information about signs and symptoms, evaluation approaches, primary care management strategies, and specialty referral guidance for each symptom cluster. While it is never wrong to refer to a higher level of care, most post-concussion symptoms will resolve in about 2 weeks. The PCM can consider using the primary care management strategies to address symptoms during the first 2 weeks after a concussion. For example, if a service member reports having persistent headaches, follow the symptom-guided management table and review the evaluation tools that are recommended to assess headache. In this case, the PCM can evaluate the patient by having them complete a HIT-6 and by examining their answers to NSI questions 4 through 7, 9, and 11. After using the recommended symptom-specific evaluation tools, the provider can then refer to the table's primary care management column for recommendations and resources on how to best treat these symptoms. Continuing with the prior example, the table recommends that the PCM should provide initial headache management using acetaminophen every 6 hours for up to 48 hours post-concussion, followed by NSAIDs as needed. The PCM can also consider traditional Chinese or medical acupuncture, if feasible, or refer to the headache following MTBI clinical recommendation for more information. If the service member shows no improvement, or if their symptoms persist for more than 15 days, the PCM can use the specialty referral guidance table to refer to a higher level of care. For our headache patient, first consider referral to a concussion care or TBI clinic if available. Then consider referral to neurology, physical medicine and rehabilitation, or neurooptometry using your clinical judgment and the resources available at your military treatment facility. We recommend that you take time to look through the symptom-guided management table for primary care management strategies focusing on the additional resources in each of the categories so that you can confidently manage the most common symptoms associated with concussion. In this video, we reviewed how to apply primary care management strategies for service members who are not progressing as expected in the PRA, and when to consider specialty referrals. Congratulations! You have successfully completed the TBI COE PRA training. We hope these videos help you feel confident in treating service members with concussion. To test your understanding of the PRA, please complete the accompanying interactive clinical case scenario.